During a consultation, I sit down with my prospective patient and we chat and talk for probably a half an hour, 30 minutes. We talk about her various concerns, issues she would like to address and change and restore.
I think I'm okay with the size. Okay. I just want them to go back where they used to be.
So let me show you a couple pictures that are pretty representative of some of the things we talked about, okay? And we look at a lot of examples and pictures of patients of similar things we've done before to give her a better understanding of what we can offer and how we can apply these things to her body, and her concerns. After I've taken a full medical history and explained some of the things that we can do and components of those procedures, then we turn into an exam room where she changes, and I come in with one of my associates and we do a full physical examination and a discussion about each of her body parts and about each of the things that we can have to offer. After meeting with Sandra, I've come up with a surgical plan designed especially for her and her body. We're going to start out with some facial liposuction and easy contouring of the face to define her cheeks and her neckline better. She will have a breast lift with augmentation and implants. She needs a very extended abdominoplasty or tummy tuck with a lot of muscle repair. On her arms, we're going to do liposuction combined with a small skin excision procedure for tightening of the upper arms in the armpit region. We're going to do gluteal reshaping with gluteal augmentation or buttock augmentation with fat grafting. And we're going to finish it off with an inner medial thigh lift. Liposuction will be a component of all the procedures that we do when we address the neck, arms, abdomen, waist, and thighs. Before we start surgery, Sandra's going to meet with a cosmetic dentist, Dr. Fulbright.
My name is Dr. Fulbright. I am a general dentist. My emphasis is on cosmetic dentistry and aesthetic.
Good morning. Hi, Dr. Fulbright. Pleasure to meet you.
To begin with, we're going to start with Sandra. We're going to get her in the chair, give her a quick tour of her mouth with our intraoral camera, take all of our necessary records, impressions, x-rays.
My teeth are straight, but I've got a lot of wearing on them and a lot of silver in there.
Actually, Sandra's teeth aren't horrible by any means. Teeth are in the right position. She's had braces in the past.
I've got a really ugly bridge.
I just need to kind of fix some of the shapes of the teeth, the lengths, and the color. We are going to put veneers on her. We're talking about doing 6, possibly 8. We're going to be doing somewhere probably in the range of $15,000 to $20,000 worth of dentistry for her. From start to finish, her procedure should take anywhere from about 2 to 3 weeks. It won't hurt at all.
When you're talking to someone or you meet someone, the first thing they look at is your smile.
Well, we think for a transformation, we're going to make sure that her teeth look natural, but yet beautiful.
Having a nice, beautiful, white, big smile is going to be amazing.
I think her self-confidence is going to skyrocket.
And for an added ego boost, we're sending her to meet with life coach and therapist, Brenda Beardsley.
My job as a self-esteem coach, I meet with her and we discuss what her expectations are, if she has any fears or anxiety about what's happening.
Scary, I guess, when you stop and think about it, there's surgery involved.
It's important, especially when you're going through surgery, to alleviate any of that nervousness or anxiety by talking about it and talking it through. It's going to help with your healing. It's going to help your scars heal better if you're not as anxious and tense. So that's really a big part of what I do.
So I have something for you to start the process, and this is a journal.
I would like her to keep track of what's going on with her throughout the process.
Nervous or excited?
So the issues that we're going to look at in particular with Sandra are issues of self-esteem and self-confidence.
I think I'm insecure with my body image.
What Sandra has been seeing in reflection in the mirror all of these years is not who she feels like inside.
I've got 2 gorgeous little girls that I love to be active with, but gaining weight and hasn't helped, so it's hard to be active with them.
She wants to feel as good on the outside and look as good on the outside as she feels on the inside.
One of the hardest things about not being my old self is going on vacation with my family. No matter where we go, it's going to be somewhere fun and bright and sunny, which means bathing suit.
Physical change can affect a person's psyche in a positive way, and that's what we're hoping for with Sandra.
I'm going to be really happy and not going to be so self-conscious. Today's surgery day, and I'm really excited. I'm not nervous. I thought I was going to be nervous. I think I'm just still really, really excited, so I can't wait to go in there and get everything started.
I'm a little nervous still, but as long as Sandra's not nervous, that's what's important. I could carry the tension for both of us.
Hi. How are you? I'm good. How are you?
Good.
Today's a big day.
Yes, it is. Sandra, you ready?
And
Kisses goodbye.
Oh.
bye.
You're all mine now.
Awesome.
see you in a couple hours.
See you later.
Today is the first day of surgery for Sandra. We're going to be performing liposuction and buccal fat pad excision around her cheeks and neck to contour these areas. We're going to be performing slim laser lipolysis liposuction of her arms and her surrounding chest wall region, and a short scar technique breast lift. Should take us about 4.5 hours or so. We're going to be under general anesthesia. We're excited to get started. Look forward to it. Alright, so we're ready to scrub and get going on this case today. We're going to start with the liposuction around the neck and the arms, and then we're going to follow that up with all the breast work. Alright, we just finished liposuction. We're moving on to the breast lift, which is a circumvertical mastopexy. Everything went really well. We're just going to get her cleaned up, get the dressings on and garments, and she'll be in recovery in about 5 minutes. The first leg of this recovery for the next 10 to 14 days should go pretty smoothly and pretty easy for Sandra. She's healing really nicely, and I've been very happy with the way she looks and is progressing at this point. Today, we're going to do all the abdominal and gluteal reshaping. That includes a tummy tuck, liposuction, buttock augmentation with fat grafting, and then we're going to follow that up with an inner thigh lift. Day 2 is a little bit more of an extensive surgery. It's also going to be the more dramatic surgery, where we're really recontouring her entire waist and buttock region. It's a little bit bigger surgery. It's a little bit harder recovery surgery as well. That's why we planned it as the second stage after she's already got through an easier first stage on this. We just finished the tummy tuck. We're about to move on to the buttock. She's done great. We're going to get her in recovery in a few minutes after she gets all her dressings and garments on. She's going to start to work with some of our makeover team after she's gone through the initial recovery after her second stage of surgery.